So it's my pleasure now to introduce Andrzej Jolik, who is the Business Development Director at Better, the Slovenian IT business that has been pioneering open EHR in various parts of the world, including Moscow, and doing some truly interesting innovation in health IT. So without further ado, I'll hand over to Andrzej.
Thank you, Bledin. Good morning to everyone, and thank you for joining. Today, I would like to explain some of our experience and from the field of healthcare IT and our observation why we feel that healthcare teams and the patients would deserve a more personalized approach to IT, and also share some of our ideas again and experience from the field, how you can assemble such personalized, data-driven and fully connected healthcare IT suite of solutions. But before we get to that, first let's look at the state of the global healthcare and what are sort of the key challenges that health and care is facing. It's clear to everyone that population is growing, and with that, especially in Western countries, the population. Yes. Is it? Can you see it? Just a second. Okay. Yeah. Okay. Apologies. All right. So the population is aging. People are getting older and older, and what this brings with it is obviously that the challenge of more chronic conditions in the population. One statistic says that 1 in 4 in England already have 2 or more long-term conditions. And what's also interesting, and I would assume that with COVID situation, this is only getting worse, is that a lot of people also have accompanying mental health conditions as well. So these are all the areas that need to be addressed and are presenting additional sort of challenge to our health and care. And then there's another aspect which shouldn't be overlooked. That's the burden on our medical teams who are dealing with these challenges and increased pressure. It's interesting that a big number of physicians and medical teams say that they are often experiencing feelings of burnout. Deloitte says there's 78% of those. What's also quite interesting is that by 2020, it's estimated that the doubling time of medical knowledge will be just 73 days, which means that there's a lot of new knowledge, a lot of new findings are coming, and medical teams are struggling to keep up with those challenges. And of course, there's the aspect of IT, right? IT should be helping medical teams with their daily challenges, but as it turns out, that for each hour spent with patients, there's the need to spend nearly 2 hours writing the documentation into the IT solutions. So obviously, this is presenting big challenges for the healthcare and big challenges for healthcare IT as well. Then there's also this constant change in healthcare. There's new business models, there's new approaches to health and care. Clinical location these days is no longer typical, so clinicians can be on the remote locations. Also, patients on the other side are no longer always required or expected to be with a clinician, and the natures of encounters are changing with new healthcare and new models of care. And it's all going towards more value-based care, towards more personalized care. And it's quite interesting that some time ago, Harvard Business Review with Michael E. Porter was describing an approach to a more integrated care, which is looking at patients more holistically, not just within one particular organizations, but more on an integrated approach across levels of health and care. And what we are experiencing or learning today is that health is starting to connect more and more also with social care. And in the article, Porter explained or argued that for all of these changes and ambition to move toward a more integrated care, and be able to track the outcomes of a patient and focus really on the outcomes of the patients, it's important to have the right sort of a digital infrastructure in a form of a health platform, which will enable these changes to happen and will enable better sort of connectivity of health and care across different levels of care. And the characteristics of this platform, he described as following. So the platform, digital health platform for healthcare, needs to be centered on patients, need to use common data definitions so that everyone working with a patient will always understand what's going on with the patient and what's the key data that they need. It needs to encompass all types of patient data so that you always can offer a holistic approach to patients. And it's, as I said before, now becoming even more apparent that social data is also quite important when it comes to overall health and care and also the outcomes of the patient. And obviously, medical record needs to be available to everyone in these virtual teams. The health data platform needs to be designed in a way that it makes easy extraction of the information, either for the use when you're working with a patient or when you're doing population care management, or when you're sort of using the data for secondary use cases for research or similar. And what's also very important for such a digital health platform is to have template solutions, order sets built in that help within the overall care process. Why now? There's, all of these changes have been happening over the last couple of years. We've seen the trend and the need for change to sort of happen. But the time now with COVID is actually showing that having the right data at the right point of care is really important, because COVID changed healthcare over the night. Patients stayed at home, new solutions, new healthcare IT was needed. The problem was that a lot of this healthcare IT was not connected and the data sharing was not done easily. So the right solution, the right approach would obviously be to allow this kind of agility to introduce new kind of applications, build ecosystem of different solutions, but those need to be properly connected. What's also key is that these kind of ecosystems will be built on top of an open data platform based on standards that will enable integration of existing legacy application as well as new applications, and that it will enable anyone to easily connect their solutions into the ecosystem, and then everyone in terms of medical teams or patients to be able to easily use these solutions in the ecosystem. Because at the end of the day, healthcare IT needs to address the needs and wants of patients on one side, where we would expect to have tools and applications when we are in health and care that are as user-friendly and as simple to access and use as, let's say, other applications that we have. We want to be confident that when we are with care providers, either face-to-face or remotely, they have accurate and relevant data available about our current and historic state. And we also want to be able to keep track of what's going on with us, what are the next steps. On the other side, we have medical teams who also want an experience to use apps and tools which are fit for purpose, are easy to use, and don't take more time away from their busy schedules, and actually help them in the process of work, giving them the right information at the right time, and they need to be confident that they will always be able to access everything that's relevant about the patient they're working with. They also need applications and solutions that will enable or simplify the communication among their peers and across more integrated care settings, which is happening today, all with the purpose to make better, safer decisions and be able to spend more time with the patients. Now, Gartner put it quite nicely, these solutions need to be more personalized and more simple and tailored for the needs of different users. And the analogy they used is from music industry. They said that, today monolithic solutions in healthcare are almost like vinyls, where, you have to have all of it, even if you need just a small portion of it. Then the integrated approach or best of breed, it's like a cassette where you could put together the songs or the applications that you need, but it's still quite awkward. And once you have it, you cherish that, you didn't want to change it. And with the streaming services that are happening today, you could basically adjust the songs or what you're listening to any minute, the way how your mood changes. And that's exactly what they're proposing needs to happen also with healthcare IT, so that users can adjust and personalize their applications. How do you do that? The shift needs to happen from monolith approach where you have database applications as well as user interface in one big mesh, a monolith, and then you integrate, which is impossible to really do well, to a more modular layered approach where it all revolves around data, which can freely flow, and then you have a rich set of applications which can connect to one another on the data layer, no longer to one another. And that's the only way how you can start personalizing your experience with IT. How can you do that? So obviously you don't want to let go of the existing investments in healthcare IT. There are good solutions that you already use. So the first step is that you have what you have and enhance it by deploying a health data platform, which will put you in control of your data. Then you will set up a structured clinical data repository so that you have a vendor neutral patient record, which will be there for life, because you'll start integrating data from different solutions. You need to be strict on the use of standards across this ecosystem and across all the applications. And then as a first use case, once you start bringing data in, you can set up a unified 360 patient view so that all your medical teams can have view of what's going on with the patient, regardless of where the data was created. And then you can start adding different additional applications and use cases into the ecosystem. And it's also very useful if you can have agile tools, low-code platform, which can help you with customization, configuration, and creation of simple use cases that are missing. And this is how you then start building and extending your ecosystem into the future, and alongside building a lifelong patient record, which will prevent the future needs to migrate the data. We've been doing this with customers across the globe for quite some time now. We have 500 different hospitals using our solutions and our approach. We are present in 15 markets. Our primary market is UK, where we're working with hospitals like Somerset NHS Trust, Oxford Health, South London and Moseley. And we're also present in Germany, working with hospitals like University Hospital Charité, Hanover, Heidelberg, and others, helping their medical teams make more personalized approach to healthcare IT. And at the same time, our approach has also been recognized by Gartner just this year, where they've put us alongside other players in healthcare and recognized the efforts where, you know, the future of ecosystems and the platform approach will revolve around data and solutions in the ecosystem, and how you can actually make this work for medical teams so they can make more informed decisions and rely on the data that they have available. Thank you very much. Any questions? I would be more than happy to answer.
Thank you very much. One quick question before we break for coffee, if I may. Looking at this approach on open platforms, sometimes what I hear from certain organizations is their expectation is that open platforms are relatively small systems, that this is not being deployed at very large scales. Can you tell us something about whether that's true, or whether there are really good examples of that being deployed at scale?
Yes, thanks for the question, Ledin. So we have our biggest sort of deployment of the platform is the city of Moscow, where they've built a citywide EHR record using our platform. And they've connected more than 400, they call it primary clinics, as well as more than 70 hospitals. And the whole city of Moscow is 12 million patients. So they produce about 20 billion documents and records each year. And this is only growing. So the whole sort of the city is running from a single EHR, which is quite a good approach. But then also working with several hospitals in UK. We have a 1,000-bed hospital where they're using the platform and connecting not just our solutions, but also other solutions into the ecosystem. And the key differentiator is that this integration is no longer happening application to application, but they are actually integrating on the data layer. And as they are doing that, they're normalizing the data, they're creating a lifelong patient record, and removing the need for future migrations because the data is now under the control of a health organization or a region, and it becomes much easier then to swap out the outdated applications and bring others in. And at the same time, anyone that's connected to the ecosystem has full access, obviously under rules and security privileges, to all the data in a single patient record.
I just see that there's one question for you in the chat box, which is just asking whether the data in your solution is fair.
Fair.
Yeah.
Oh, fire compliant, probably. Or.
Yeah.
What? So we have. I'm not sure. Is this a technical question? So we do have Fire APIs that can easily connect to any applications that use that to bring the data into the platform and obviously expose the data as well to other applications in the ecosystem.
Yeah. Okay. So we'll move on to coffee break now. So you have just over 10 minutes, and if we can reconvene at 1:45. Thank you very much indeed.
Thank you. Have a good coffee and good afternoon, everyone.
Okay.